The data we presented on Friday here at ESMO are related to a sub-study of the main shortHER trial. The shortHER trial is one of the studies that evaluated the non-inferiority of a shorter duration of adjuvant trastuzumab, 9 weeks in this trial, as compared to 1 year, combined with adjuvant chemotherapy for patients with HER2-positive early breast cancer. So this was an academic-driven trial, and the results were just published on Annals of Oncology, showing that the results failed to demonstrate actually the non-inferiority of 9 weeks versus 1 year of trastuzumab, because the confidence interval of the hazard ratio crossed the non-inferiority margin. And what we presented at this Congress was a sub-study evaluating the association between tumor-infiltrating lymphocytes and metastasis-free survival in around 70% of patients enrolled in the shortHER trial. The main population of the shortHER trial included 1,253 patients, and for the additional analysis we had 866 tumor samples available to score TILs.
Okay. And what were the main findings?
The main finding is that we found a significant association between increased TILs and improved metastasis-free survival. We tested TILs primarily as a semi-continuous biomarker, and we found that for each 10% increment in TILs, we observed an hazard ratio for metastasis-free survival of 0.76, and this was statistically significant. And when we split the patients into groups according to high or low TIL levels with a 20% cutoff, we were able to show that patients with high TILs had a 5-year metastasis-free survival rates of 95.7%, which was statistically higher and better as compared to 91.1% for patients with lower TILs. And even in multivariable analysis, TILs were an independent prognostic factor for metastasis-free survival in all patients and in the subgroups of patients with hormone receptor positive and negative disease. And another key result of this study was the result related to the interaction between TILs and the treatment arm, because we were able to show that low TIL patients actually derived a benefit from 1 year trastuzumab as compared to 9 weeks, and this was statistically significant, whereas patients with high TILs had an excellent outcome irrespectively of the level of TILs. And therefore, one of the key conclusions is that this is the first study that showed that TILs could be used as a marker to select patients for de-escalated treatment. Of course, this is the first study showing that, because this is the first study that tested TILs in a trial comparing shortHER versus 1 year trastuzumab, and we need to validate these results.
Okay. Are there any plans for when that validation might occur, and with what populations?
Yes, the shortHER trial is one of the 5 trials, of the 5 non-inferiority trials that compared shorter duration of trastuzumab versus 1 year. And actually, in order to validate these results, it would be useful to have data on TILs from shown also from other trials with a similar design.
Okay. Do you know of any trials that might be conducting according to a similar design, or are they still forthcoming over the next couple of years?
No, there are 4 other trials with a similar design as the shortHER, and there is already a plan to perform a pooled analysis of clinical results, and we also are looking to possibilities in order to collaborate also for this type of translational analysis.